Welcome everyone. I think people are just joining right now. And my name's Shankar Vijay. I'm one of the GP leads in the digital transformation team in London. And this is a joint effort where we're really glad to present to you this webinar on behalf of the London team, but really using the national team to present the content. I'm actually here on to stand in for one of my colleagues, Tara. She's part of our team who's been leading on the work, and she's been really pivotal to help arrange this webinar for you. So a big thanks go out to her, and unfortunately she's just not able to join us today. So if we move on to the next slide, a few rules. So we are definitely recording this session. And I just want to highlight, we're definitely going to share the slides. I know everyone wants to know, if the content's going fast by your screen, the slides will be shared. We're really also aimed for the recording to be shared as much as possible. There are links throughout all the slides, so lots of useful information and things that can expand on what you're hearing and what you're seeing. And we've got a question and answer function live throughout. So if you look at your teams, hit that button. Please do maximize this session. Ask questions all the way through. We'll try to answer as much as we can, and we'll try to wrap up at the end with another opportunity to go through things we think we may not have answered. And like I said, you're going to be introduced to lots of colleagues who are presenting content, and we'll all be jumping in to try and answer the questions as we go through. So if we move on, really next slide. So really busy slide. So really, what is the aim of this session? It's that we all get the most out of understanding what the NHS app does. Sometimes we're just so busy, we think we know what it does, but sometimes we don't. So that's what we really hope we get out of it, and how we can put it into our daily working practice. So wherever we are in the NHS, so general practice, and also I'd say, just in our own lives as patients and helping family and people around us in our local populations. Yes, there's lots of busy documents with lots of references to NHS chapters. We can't just help switching on the TV nowadays without seeing another announcement about how the NHS app is going to be doing even more for us. And I think you may see some glimmers of that within the content of this presentation. And I'm sure that this is going to be the start of several sessions as we start to see more and more about what the NHS app can do. So let's move on. Now I'm just going to just a quick next slide. So if we go to what is going on in London. So wherever you are in London, I can tell you that lots is going on. And when we look at this data, for a start, if we look at the population, over 60% of our population is registered. So if we look at us in London, we're pretty much the same as the national figure, 61 or 62%. If we look at the people who are using it, our patients, over 57 million people sort of logged into the app, had logins. Oh, sorry, 57 million logins in the last year. Tons of repeat prescriptions are happening. If you look at that figure, it's grown, almost I'd say almost doubled from 2023 to 2024. So there's a big rise in that. And I think when you see later on some of the content, you can see how that's just going to keep growing. Appointment booking, again, growing, almost 500,000 last year. And notifications enabled. If you don't know what that means, you'll see later on. But effectively, to get NHS app messaging into your NHS app, the patient needs to have turned on notifications on their device settings. Let's look at the patient population. I think that if you look at the bar chart on the bottom left, I think you look at it as two ways. I would say that we're close to the national picture. London's maybe slightly lower than national. And maybe that's the reason why this webinar is looking at what can we do more in London to grow. I think when we look at our ICBs, I think you can see there's slight differences, but maybe we're all in some ways in a similar place. We could look at one ICB being a little bit ahead of another ICB, but it wouldn't take much effort to catch up and overtake. So just not trying to be competitive, but maybe slightly competitive about where we are as ICBs in this space. And look at that beautiful, colourful chart at the right. I just see that massive growth. So we're growing year on year. Things are growing, our patients are using it. And if we rewind back a bit, obviously there was a growth in the COVID pandemic, and then there's maybe a bit of a reduction. And now we're starting to see that we're all growing again and looking at what we can do to maximise the NHS app. Next slide. And I'm not going to go through all of this, but what I want to shout out is that every ICB has got something to feel proud about, that they're doing something slightly different. And that we can all learn from each other, and we can all borrow from each other, I'd also say. So Northwest London on the left, maybe some things around little cards, looking at different language barriers. Northeast London, really again, campaigns looking at the pharmacy outreach work, and again, that patient-facing thing, and looking at what their practice websites are doing. Can they be updated to promote the app too? If we look at North Central, again, a lot of social media work, getting onto the frontline NHS App Ambassador, promoting that, and looking at pharmacies and what else can be done. Southeast London, whoa, they've done some great stuff about social media, some great videos, really marketing using Google search optimization. And if you haven't spotted their bus campaign, it's something I think we can all learn from. Great low cost marketing that has huge impact to particular populations. And then next door in Southwest London, again, we've got to shout out again about some of the social media stuff that they're doing. And again, street ambassadors, getting some bus stop work as well. So clearly there's things we can learn from each other, but the main thing is that everyone is doing something. If we go on to the next slide. What are we doing as a region? Well, we're first of all, you guys are doing a lot of stuff, and we're just helping to promote that and share from each other, and again from the national materials. But things like this webinar is and trying to help arrange it is one of the things we're trying to support. But if we looked at it, the dashboard data, some of the dashboard data that we can see, it can maybe point us to where we need to focus a bit more on, whether it's about turning on more patients' notifications, increasing prescription usage. So we use that data to try and govern where we should focus. We try to pull together some of the communications and marketing materials. I think all of us would say that, we would always want more, more comms, more things. So, how do we use what we've already got? How do we be smart and share what we're doing? And then, like this meeting, sometimes some of those issues, some of those themes, some of those development requests, we try what we can to help gather them together, raise them with the national team and make progress. And again, some of the ICB leads get really involved in that. And it's been a really collaborative space that has built up over the last couple of years, and it helps, I guess, everyone in London, but also I'd say helps everyone across the country. Next slide. So I'm going to hand over. I'm sure that I don't need to introduce some of these faces because they're really familiar in this space. And if you don't know them, I think you'll be really delighted to meet them. So could I ask you to, I've got Emma and them to, could I turn to you guys to introduce yourselves? So Emma.
Thank you so much, Shankar, for that regional update. It's really great to see the work that you are doing in London. And I just want to, before we begin, I want to have a special thanks to Tara Bush, who organised this and made this possible today, and all to everyone else in the London region who has supported us. Also want to take that opportunity to thank you all for attending, because 90 minutes is a considerable chunk of time out of your day, and we do really appreciate that, especially because it's year end as well. So we are going to be the ones that are delivering this training session. Myself and James Butcher are the ones that are going to be presenting, but it has been a team effort from our team, the policy and engagement team. So you'll be able to see Patrick and Grace online as well. So if you can give us a wave like you're on a TV show. And they're in the background. So Patrick will be looking after the Q&A, and Grace will be managing the quiz and the polls that we have got. So yes, it is an interactive session. So if you do have your phone on you, recommend grabbing it, because we're going to be doing a quiz shortly, and you can also use the phone to log into your app and go through it as we talk about it. So we will move on to the presentation with the quiz first. So on the right hand side, you will see that there is a QR code. So if you want to just put your camera to the QR code, or you can go to menti.com and then use the code 38779616. So whilst you're all doing that, I will just give a little overview of what we are going to be discussing. It is a jam-packed agenda, but we're not going to be presenting all of the slides. There'll be some screenshots that you can take off, and they're really handy, showing you how to actually access that. We pulled the training session together following the drop-in sessions that we held. So anyone who attended them, thank you, because they were really useful to help inform us what information to share. We have tried to simplify it as much as possible because it's back to basics, but it does cover everything in the app and a little more. As we mentioned, we do have a Q&A session, so ask your questions throughout. Patrick and we've also got our user researcher Simon, who'll be able to answer the questions, but any that we haven't answered we'll be able to answer at the end. And we've also got a case study as well, so someone from the London region who's also an NHS App Ambassador, Marianne Smith, will be coming along to give a presentation to talk about some of the great work that she's doing in her area. So what we'd like to do now is I will stop sharing and we will get the quiz on. Perfect. Wow, we've already got over 65, the players are coming up, right? Brilliant. So let's get started on the quiz. That's amazing. So 71 players. Let's see how much you know about the NHS app. So what age can patients register to use the NHS app? Is it 13, 16 or 18? And you see that there's a little timer there, giving you a bit of time to answer that question. What we did have before when we was trialing it was a fastest finger first, but we thought we'll take that that pressure off, and we just want to know if you get the right answer. Okay, so brilliant. So no one did answer 18. The correct answer is 13. So a mix there, with most people actually saying 16. So we will be talking about that as we go through the NHS login slide. On to the next question, please. Question 2. Drum roll, please. Just waiting for that to come load up. So how can a patient verify their identification to gain access to the NHS app? So use it digitally using NHS login, in practice verbally, in practice with physical ID, or all of the above. A few more questions. And if you're unable to get onto the Menti, if you can put your answer in the chat, we can have a look at that there as well, or just write it down on paper, and you'll know if you've answered the question correct. So the actual correct answer is all of the above. So they can actually come into practice verbally, because if they're coming into the practice and you know who they are, they can answer some questions, and then you'll be able to provide them with that access. So next question, please. There's a leaderboard here. So whoever, there's quite a few that are up there, but they put Wolfmeister #1. So well done, Wolfmeister. Great name. On to the next question. So on which devices can you access the NHS app? Mobile device, tablet, web browser, or all of the above? And the correct answer is all of the above. And as we will be sharing which ones that you were able to in this presentation. So you're all doing well. And then there is one final question before we do, we kind of gauge how you're feeling about the app. So how can a patient receive notifications about messages in the NHS app? Is it notifications are enabled automatically? The patient must turn on notifications in their device setting, or their GP practice needs to enable notifications for them. Last few seconds. And the correct answer, which the majority of people got, is that the patient must turn on notifications in their device settings, which we will talk about when we come to the notifications and messaging section. So thank you all for playing that. I thought it's a little bit of fun to get us started, but also just to gauge where you are with the app. So now we just want to find out where you currently are feeling with the NHS app and how confident you are. So 1 being not confident at all, and 10 being really confident. I could be up here presenting, and answering the questions. Awareness of the NHS app and the benefits of GP practices and patients. How confident are you with that? About how confident are you with understanding the features and functions of the NHS app and how they work? And then also, how confident in promoting and talking to patients are you about the NHS app? So it's looking at around 7 for all of them. So that's a really great place to be. So hopefully after this presentation, we will move you on a little bit, so you're up to 8 or 9, even 10. Thank you very much for all participating in that quiz. We are going to have some polls later on, but for now, I am going to take you through the NHS app. So the NHS app has been around for 6 years, and it is owned and run by NHS England, and it's available, as it said in the quiz, to anyone over 13 years old who's registered with a GP in England or the Isle of Man. It was redesigned last year, and we're constantly making improvements to it, and it has grown a lot from where it began, hence one of the reasons for this session. And one thing that I will actually point out now, that we have got QR codes on all of these slides. So the slides will be shared, but there's a link, but you can also use the QR code, so it'll take you to where the link is. So if you're wanting to have a look now, you can do that as well. So this slide shows what software versions of the devices the NHS app is currently compatible with. So it's a useful slide that you can use and review. There are some versions that still allow users to still access the app, but unable to provide technical support. And then there are some versions that do not meet the requirements, so then unable to download the app. So where this is the case, we have got the NHS account. So this is available to access via the NHS UK website. It's in the top right hand corner. And so you can log in to the app on a browser. You can actually use it on your phone, but on the browser. And it's useful for people with those incompatible devices, but it's also really useful for people who do prefer to use like a website, a bigger screen. It's easier to read. So what can the NHS app do? So there's a lot of advertisements and it's focused on repeat prescriptions, appointments and records access. But as you see on this slide, that there are so many different features which we will be running through in this session. But what I do want to highlight is that it's really great for different stages of the health journey. So being able to get well for those people who are unwell, then stay well to manage your prescriptions or booking in vaccinations, and then managing the health. So looking at health records, nominating pharmacy, looking at the your NHS number. What I will highlight here, there's two things that I do want to highlight, that the functionality is relying on what's being commissioned locally, so such as online consultations, or things may differ from practice to practice with appointments. And then also the NHS app mirrors what is in the GP system. So it's not new to the app, it's just mirroring what's in the GP system. We went through the, Shankar took us through the data for London. So this slide is just nationally. I want to just point out a few things, that 75% of adults in England are signed up to the app, which is a really great percentage to be at. And we are climbing on month, we're steadily growing of the amount of usage we get. And some benefits that we've got is fewer calls to practice. It can money saving with messaging, and also time saving with the repeat prescriptions and digital prescriptions. And we'll touch on some of the benefits as we go through the slides as well. What I do want to share here is that we do have patient and user feedback. So I'm not going to read all these all this information here. This is just to show you what we do have. We have got some patient case studies which you can have, and we have a team of user researchers that go out and collect information. But I do want to pick on that top left one, because it's from a British Sign Language user, and having access to the app has been really beneficial to them, because they were able to manage their health using their phone, because they was unable to call the GP directly. So it's fantastic that we are actually helping patients there. So what to do now is move on to a poll. So if we want to grab a phone again and go to Menti, this is a different code. It's 72942780. So we've got a series of polls running throughout the session. If you just answer the poll as we bring it up, because it will move you on to the next one, but if you can remain patient and not eager, then you'll be able to be interactive throughout. But I will stop sharing and we'll get the poll up. Just bear with us. So just to get a flavour of who we are speaking today, we've got 159 of you online, which is really fantastic. We just want to know what your role is, so we can just see who is around. we got anyone joined just yet? So just remind you of the code is 19782671. I'm not sure if we've got anyone online at the moment for the poll. Right. Okay, I think I will. Right, okay, I was just being a little bit impatient there. So we've got admin. And if you're struggling with the Mentimeter, if you do use the chat function, the Q&A function, we can get that as well. Immunization coordinator. Administrator, practice manager, oh, brilliant. They're all coming through now. Care coordinator. I don't know what SPLW is. If you can type that again, that'd be really fantastic. Digital change manager, receptionist, IT lead, admin, brilliant. So there is a variety of roles there. Oh, fantastic. They're all coming through now. Brilliant. We will move on to the next poll, but you still answer that question, and we will be able to pick that up. But we'll move on to the next question, which is, have you got the NHS app? We'd love it to stay fully blue, but if it's no, be honest, that's totally fine. And hopefully, by the end of the session, it will be a yes that you have as well, or yes, you will do. Okay. So it's looking like, yeah, everyone at the moment will love it. We'll keep it on that blue circle and we'll move on to the next question. And this is the last one of the. Oh, okay, we've got one. It changed. So it wasn't full blue when we moved around. So were you aware of the NHS account? So I mentioned earlier about the NHS account. So you're able to access the NHS app via a browser. So you can use it on your laptop. And everyone so far have been aware of it, and someone has actually tried it. Oh, we've got a few more that weren't aware. Brilliant. So we've highlighted that to you. So hopefully that is something that you can go on and tell your patients that they were able to access that. And we've got more in the session about it. Brilliant. So the majority have, but we do find this that a lot of people haven't been aware, so we are promoting that more. So thank you for everyone who has taken part in this poll. Apologies to anyone who has been struggling with that. We are going to talk about NHS login, and I am going to pass on to my colleague James Butcher to take us through that section.
Thank you very much, Emma. Good afternoon, everyone. Thank you for joining the webinar. As Emma mentioned earlier on, I'm really pleased to see you all here today. Yeah, NHS login. You know, we talk about the NHS app, the NHS website, NHS UK a lot, but login is our unique identification process that we have to not only prove identity for the NHS app, but actually for another, I think there's 60 or 70 third-party providers at the present time who use the login identification route for their own functionality. I'm just going to I've just cut and pasted the link into the question and answers. If somebody could publish that for me, that would be great. That shows you the most up-to-date position around about the end of February this year, how many login partners we have. So we've got this team, NHS Login, who sit beside the app team, and they're working on the login process. There are a number of ways that a patient can register for the NHS app, but there are 3 routes for login that we're going to cover here today. And we've already moved on to the first slide, which is absolutely brilliant. So this is the automated prove your identity, or PYI is the acronym for that. And at the present time, you're looking at a turnaround time of approximately 1 day, 24 hours. So the login team who I was just mentioning, are always looking to make the login journey faster and quicker. And there's so much work it goes on behind the scenes that we hear about them refining the process. I think that they were able to shave 4 seconds off the time just before Christmas, which doesn't sound like a lot, I know, but actually, as a user, when you're doing PYI and going through the process on screen, anytime we can shave off is absolutely brilliant. So to do this, you'll already know, but you need to find the NHS app in the Apple App Store or on Google Play, and you will need your name, address, a valid email address, and a mobile number to start with. This is the process where you will do a face scan or you record a video. Now, I'm just going to quickly read them out. Acceptable forms of identification currently are a passport, a UK driving licence, be it full or provisional, UK biometric residence permit, or BRP, is the acronym for that, a UK residence card, a UK application registration card, an ARC, a citizen card, a European driving licence, it has to be a full one, European national identity card, or finally a valid UK entry clearance visa sticker. So there are your forms of identification. Moving on to the next slide, please. So this is the one that I know you'll all be very familiar with in practices, especially the patient online linkage key. So this involves creating the NHS login account without using the photo ID that I just talked about. The primary care GP practice can provide a linkage key. You're required to have the organisational data set, the ODS code, and account ID to complete the login registration. Once this has been undertaken by the patient, they will receive an email confirmation within a few hours. Next slide, please. So this is like a slide here. It shows the offline journey, and it really kind of like details the process for patients, of course, who may not want or be able to go through the prove your identification journey. So I'm not going to read those out. Once you get the slide pack, you'll be able to digest them in your own time. Again, this one really is just for guidance, looking at the 2 most used, most common clinical systems, TPP System 1 and EMIS. There's some really, really useful information on there. Really important to read this, actually, because we are aware via our service desks for not only the NHS app, but also, of course, NHS login, that there are often issues with linkage keys. And I think what's really important here, right down the bottom, they expire after 14 days. So please bear that in mind. So this is the mobile identity verification fast track process. Just some screenshots for you there about how it works. This is another journey. Patients already registered for Patient Online, or POL as we call it, at their GP practice, and their phone number matches one of their records, they can be using that process. And of course, as we already know, they will have had to have downloaded the NHS app. I just want to cover setting up a test patient. You have the ability to do this in practice because of the clinical system that you use, and you will have an ODS code. We're working internally on creating a dummy patient account as well. You might describe this one kind of really as a sandbox environment where you can download it to your phone, your tablet, or use the web browser, and it's independent of having to be reliant on the GP IT system and the ODS code. That's work in progress. As soon as we fingers crossed, we get this piece of work delivered. We will then communicate out by the London region digital team, who are of course on the call today. We think it's going to be a really great way for not only ourselves, people in practices like you are today, and especially NHS App ambassadors, who we'll touch on later on, just a very easy way of showing patients how to use the NHS app. So I won't dwell on that anymore. The detail is there on how to set up a test patient. So there's some top tips there for the login process. I'm not going to read them out. You have them there on the slide. I'm going to pass back to Emma now, who's going to talk through some core features of the NHS app. Thank you, Emma.
Thank you very much, James. So as I mentioned before, if you have got your phone, how about logging in and seeing if you have got them features as well. So these are the core features that are mentioned in the operational planning guidance that Shanka touched on at the beginning. So a lot of the slides, as I mentioned, have got accompanying screenshots, so we will be like just passing through them. So the first feature I want to talk about is the most used feature, and it's requesting a repeat prescription. And it's fantastic because it gives benefits to patients, so they're able to use it 24/7. They don't need to contact the practice. And then there's practice benefits as well, so being able to save admin time and improve work management flow and not have to print off paper. At the end of me running through the core features, we're having Marion Smith to talk about repeat prescriptions as well. So that'll be an interesting case study. So we do have future plans to have being able to see the status of prescription and when it's ready to collect. So currently this is live at 30% of practices, and we're steadily rolling this out further. What I do want to highlight, though, is that this service is for repeat prescriptions and not for acute prescriptions. And it's also not at the moment for electronic repeat dispensing, although that is something that is in the pipeline. So this slide here is just the steps that you need to take to get the repeat prescriptions. Also, keeping on with prescriptions, it's the ability to be able to view your prescription information in the app. So you're able to see what items you're being prescribed, what type of prescriptions, and who prescribed it. And in addition to this, if a patient hasn't got a nominated pharmacy, they can generate a barcode, which you can see on the right-hand screen on the phone, and they can take that into the pharmacy to get prescriptions, so it saves having to get a paper prescription from the GP. So the future plans here is being able to add that barcode into the phone's digital device. So, you know, when you can, with the app, I can just, with Apple, I can just double click and then it takes me to the wallet. So they don't have to log in to the app to be able to get to that device when they're going into the pharmacy. So on this next slide is just the steps that you will need to take to get there. You can also change your nominated pharmacy. So I will highlight here that if the prescription has already been ordered, it will be sent to the pharmacy that it was nominated to at the time. So it's recommended to change the pharmacy and then request the prescription. So on the app, you have got the option to choose high street pharmacy and online. But if you do choose online, what it will do is will direct you to go to that online, to the online pharmacy and do that next steps. But if you choose high street pharmacy, you put in the postcode and it will bring up the pharmacies closest to that, and it will also share the opening times, and then you just click and then it's easy to revert back to as well to your original pharmacy. And then again, here are the steps to be able to do that. With GP health records, this is the ability to see what is in the health record. Previously, we just had the summary healthcare record information, which was prescribed medicines and allergies. But since we have opened up to full records access, which includes vaccinations, conditions, notes from appointments, test results, and letters. And this is where I am going to again remind you that the NHS app surfaces what is in the system. So that's what you'll see, is what's already in the system. So, and the NHS app isn't putting additional things in there. So it really is important to understand how to manage this in your workflow if you're actually working in a practice. Sensitive information can be redacted, and then patients will also not have access to view your admin tasks or any communication between practice staff. And all the links here, there is it links you through to some walkthrough videos, which I will touch on later on, but you can see actually how that looks in the app. One of the most featured, well, not one of the most, it is the most used feature in the GP health record is being able to view test results. So this has got a time-saving benefit to both patients and practice, because patients will be able to have access to their test results so they don't need to call the practice. And then it also frees up the phone lines for the practice. So what patients can see is the results of tests that they've had at the GP surgery, and also hospital test results that have been sent to the GP surgery. So these will be able to be viewed once the practice has checked and filed the record. In the past, we understand that test results have been designed for clinicians, and so we have got a team working on it, making it so patients can actually understand more what it means. So we have got a team working on that. And then here's a slide just showing you the links on how to get there and what it looks like. Appointments. So this is a question, and I've already seen in the Q&A function that people have already been asking questions about appointments, and Shankar's answered something there. So it can be confusing for patients because different GP practices, as we said at the beginning, do offer different things. There are many practices that are using their online appointments alongside online consultations and doing that triage model. But for those that do offer appointments, naming conventions is really important, how you actually name it so a patient understands what they are actually booking into. And you're able to put appointments up to 16 weeks in advance, and the app will only show the appointments that the practice has been made available, and it doesn't include urgent. So there is an extra benefit for having appointments on that. Patients will be able to cancel their appointment even if they haven't booked it online, and they will be able to see the dates of past appointments as well. And we are working on being able to have that appointment function be going into that calendar. So moving on to online consultations. So this is a way for a patient to be able to contact their practice using a secure and confidential online form. So if a practice does use an online consultation supplier, that has been integrated into the app. And I think James had mentioned the ones that have he's put a link to the ones that have been integrated in the app, so you'll be able to see there. But a patient will be able to then fill in that online form with information about their symptoms, conditions, treatment. They can also request help for sick notes or GP letters, and then when they are going through the form, they will have to confirm it's not an emergency, but if their patient does hit a red flag, they will be directed to seek that acute care that they need. And so once that the form has been completed by the practice, then the appropriate next steps will be taken. So as I mentioned, there is a team working on the online consultations and the appointments and trying to make it a little bit more seamless, because it can be a little bit confusing. So on this slide here, you'll see on the left-hand side about the appointments, and on the right-hand side about online consultations, so slides that you can have a look at. So we've got a poll, and then we're going to invite Marion Smith to talk about repeat prescriptions. So I'm going to stop sharing, get this poll up. So there was a question, does your practice offer appointments to be booked in the NHS app? So the majority have said no, but there are quite a lot that have said yes. So that's really an interesting figure. So it'd be great in the chat for those that do offer the appointments, what type of appointment, if you could just let us know what type of appointments you're offering, and if you've had any issues with that, how you've got yourself practice prepared. That'd be really great information that we can share with others. So thank you very much for that. So I am just going to finish off with a few more. We've got notifications and messaging next. So notifications and messaging. So this is the ability to be able to receive messages from your healthcare provider via the app. It works in the same way as you would send existing messages. So with your messaging supplier, there's nothing additional that you need to do because it's integrated behind the scene. So once a message is sent, if the patient has the app, and has got notifications switched on, they'll get a notification on their phone to say that they've received a message and it's delivered into their inbox. If their patient doesn't have the app at all, it will just go to their default default option. So it's usually SMS. If they do have notifications switched on and they're using AccuRx, if they don't have notifications switched on and using AccuRx, they will still get the message in the inbox, but they will not, unless they kind of stumble upon it, they won't know that they've got the appointment. When the batch messages are sent, they've got 24 hours before then it diverts to SMS. We are currently piloting individual messages as well at the moment, and that is on a 1 hour fallback. We've got 5 suppliers currently integrated, but we're also looking into getting more. And the question that we constantly got asked in the drop-in sessions was, how about TPP? And we're currently in that planning stage, and they will be integrated shortly. So some of the benefits of using the notifications and messaging, the biggest one is the opportunity to be able to save money. So we're aware of the financial pressures across health and care, and being able to utilise notifications and messaging can help reduce the amount of money spent on this. As you can see there, we've got a figure on how much of the savings can be made. It's also really safe and secure, so it's a great benefit for patients. As you may see, there's been a rise of scam and spam and fraudulent messages, which a lot of us may have already received messages of that sort. So having the NHS app, it can give patients that confidence to know that it's from a trustworthy and safe and secure channel. And it can also reduce the amount of contacts to the practice asking, did you send me this message? Is it legitimate? There's the ability for messages for multiple care settings to be in one place instead of having that text message and trying to find that relevant text messages and you're scrolling on your phone. In the app, you'll be able to have a look and you'll be able to filter and see them when they're coming in from different care settings. So although we've been working in the primary care space, we have some in secondary. And then finally, it's unaffected by contact detail change. So this is because how messages are sent in the app. It's not down to the phone number, but the patient's NHS number. So if the patient does change their phone number or their address and they haven't updated the practice, they'll still be able to get that message. And then there's a bonus one. It is actually free to use for commissioned health and care service providers. Hospital appointments. So in the NHS app, patients are able to view and manage their hospital referrals and appointments. So this is a program that we've got known as Wayfinder. So there's currently available at 103 trusts. So with the core features, and so that's been able to view the referrals and appointments and any supporting information. But there are additional features are available to a number of trusts, which allow patients to book, change and cancel appointments, receive messages, complete questionnaires and access documents such as letters and discharge summaries. And we have started working in the mental health space and we'll be soon looking into community. We do have the team coming to our next national webinar in April to talk more about this. So more about our national webinar in the presentation later on. And this is the final slide that I'm going to talk to before inviting Marion Smith to speak. And this is the ability to register with a GP online. So if your practice has signed up for this service, it allows a patient to be able to find and register with a GP surgery via the NHS app, so they don't have to physically go into the practice. So for any practice who'd like to enrol, you just need to sign up to NHS Profile Manager. So I am going to invite Marion Smith. So I'm going to pop Marion on and pop off. Marion, if you can unmute yourself, introduce yourself, and let me know with the slides when you want me to move on.
Thank you very much, Emma, and good afternoon, everyone. So, as Emma was saying, I'm going to give a presentation today, and it's about sharing with you all an example of excellence in patient-centred digital care in a GP practice in Edgware in London, Lane End Medical Group in NCL. And this is really a sort of a story about how focusing on supporting the patients to access healthcare using digital can have such a positive impact on the patient's access to services, and also it's about releasing time back to the GP practices. So how has this been achieved? Well, it's been achieved through changing from manual processing of repeat prescriptions to 100% online access via the NHS app for patients. Manisha Patel, who has kindly shared her digital change story with us, is the managing partner at Lane End Medical Group. And Manisha is sorry that she cannot be with us in person today. She had a long-standing commitment. So I'm sharing her story on her behalf. So a big thank you to Manisha for sharing her story and letting me share it with you today. If we could have the next slide, please, Emma. So really here is sort of setting the scene around, in an era where, digital transformation is revolutionising healthcare. Lane End Medical Group has emerged as a digital champion, leading the shift from, paper-based repeat prescriptions to a fully online system via the NHS app. And their commitment to innovation has not only improved efficiency, but also enhanced patient access and experience. Next slide, please, Emma. So just give you an overview of who Lane End Medical Group is. So they're a general practice, general practitioners have worked together for many years, supported by their allied health professionals, reception and administrative teams. They have provide high standards of medical services, and you can see the range of services there, and they've been rated as good by the CQC. They're also an accredited undergraduate and postgraduate training practice, with highly experienced trainers. And one of the things that I noticed as Manisha was sharing her story with me is the big focus they have on involving the patient in the way they deliver change and develop their services in the practice. So that was really a core message that came through when she was sharing her stories, and I'll talk a bit about that in a moment. Next slide, please, Emma. Thank you. So in terms of the actual changes, so what's actually happened? Well, since January 2025, so, a couple of months ago, it's not that far ago, and following a period of consideration and preparation, talking to their patients, Lane End Medical Group, they no longer accept paper requests for repeat prescriptions. Instead, patients are encouraged and supported, key word there, to use the NHS app, which is a secure and convenient way to manage medications online. So that was the first thing. And then also we've got to think about digital inclusion. So recognising that not all patients are familiar with digital tools, the practice adopted very much a patient-first approach. So rather than simply implementing the change, they asked, how can we support you to access, repeat prescriptions in this instance? So that was really a core part of their approach in the consideration and preparation phase. And, staff ensure that those patients who are new to the app and needing assistance, elderly patients, those with disabilities, receive the necessary support to transition smoothly. And there are some patients, as you would understand, that are unable to access the NHS app. So alternative solutions are available to those patients so they can get their medications easily, but that's a relatively small number in the whole scheme of things. And if you look at their website, you can see, what they've done. You can see what they've done. Next slide, please, Emma. Thank you. So what else? So by shifting to repeat prescriptions online via the NHS app, they're embracing the NHS app. The practice has reduced administrative burdens on staff, so that releases time back to care in the GP practices rather than focusing on paperwork through manual process. And previously, processing paper-based requests was time-consuming, was the experience of the practice. But now with the digital requests, it's much more streamlined and, a quicker, improved processing of requests. So that's really, really very, very positive. And then in terms of patients' convenience and accessibility, it means they can order their repeat prescriptions 24/7 access, faster processing, and also they can track prescription requests, reducing uncertainty and improving medication adherence. So there's all sorts of benefits there. Next slide, please, Emma. Thank you. So what did they do? So the team at the surgery also use these opportunities when they're interacting with patients to let patients know about all the services available through the NHS app as part of these sort of golden opportunities where they're interacting anyway with patients. So they're not doing anything extra. They're just using the natural time they have in engaging with patients, to promote and support the patients and ask for their feedback as well, which they do as part of their core subculture within their practice. And then, this is really a model for digital transformation in this sense, because their success in transitioning to online only repeat prescriptions, does show their commitment to improving patient access, and they're also modernizing healthcare delivery. So they're engaging and they're supporting and empowering patients, to do this. And, it really shows that technology, isn't, it's not just, that digital transformation is not just about technology, it is at its core about people. And, digital being the enabler, but the change happens through people and supporting people and investing in that kind of real benefits for patients, and the practices and the system. So just to sort of say here as well, is I want to say a big well done to our digital champion, Manisha, colleagues and the team at Lane End Medical Group, providing, patient-centered digital care through transforming repeat prescriptions to online at their practice. And, for practice considering a similar shift, the key takeaway from this story has been, it's about engaging, supporting and empowering our patients, to embrace digital solutions. And that starts by asking the question, how can we support you? Then listening to that and then tailoring our approach to change in a way that's going to support the patient to make that transition. And of course, for patients who can't for any reason do that, that support is always there as well. So thank you very much.
Thank you, Marianne. We're going to have James talk through the additional features now.
Thank you very much, Emma. And also, thank you, Marion. Isn't it just great when a colleague from the system presents a good news story? It's just, for me, it's wonderful to hear what work is going on out there. And we know there's so much great work driving uptake and adoption of the NHS app in the London region within the 5 ICBs. So, like I say, great to hear from one. Okay, just wanting to cover off some of the additional features, as Emma quite rightly said. This one relates to the NHS's e-referral service, or ERS for short. That acronym's been around probably for as long as the NHS app, 6-7 years now. So when a practice refers a patient to a hospital or clinic, the patient can manage the first appointment within the NHS app. This is done in the Your Health tab and is one in the upcoming Past Appointment tabs. Alongside booking appointments, patients can also reschedule and cancel and remind themselves when and where the appointment is. Really powerful features there. And I believe the next slide that we've moved on to already, that's wonderful, is a screenshot for your background information. I'm not going to read the text out there. This just shows the journey, the ERS journey. It's always useful to have some screenshots, I know, so there it is for your information. The next bit of functionality is work in progress, and that is linked proxy profiles. And there have been some questions in the chat about it as well that I think I've had a go at answering, but I'm not sure that my answers have been published at the present time. So I'll have another look when I've finished speaking. But anyway, linked accounts, which are also known as proxy, enable patients to share their accounts with other people, such as family members or carers. And of course, consent needs to be in place. To get access, the patient would need to go into the practice and follow a process to sign up, which includes proving identity. You would follow the existing guidelines that are already out there for proxy access. Patients are able to get access to their child if they are under 11 years of age. Once a child turns 11, the system will cut off access automatically, and then consent will have to be given. And we sometimes refer to this, and I'm sure you will all know, the GP doing a Gillick competency test. Access will allow someone else to support their health services, such as order repeat prescriptions or booking appointments, for example. If a patient does have access, they can switch accounts via the NHS app. So at the present time, you can have access as long as it's at the same practice. Now, there is some work going on, as I said, behind the scenes at the present time. And it's actually North Central London, of all places, Marion's Patch, where some of the piloting work is taking place. Timescales will run throughout the next financial year. A lot of work going on behind the scenes. And actually, at the present time, the proxy pilot is likely to be for one GP IT supplier. If the patient and proxy are at different practices, but both practices are on the same system, then it's likely that this would be accessed by March 2026. So in a year's time. This will really depend, and I can't emphasize this enough, on the GP IT suppliers agreeing to ours, that's the NHS App team's timelines. And again, this next slide is just for information. This shows the linked account profiles, just some screenshots for you to have. Another piece of functionality here, enhanced functionality, is NHS 111 online. So I think that this is really simplistic, so I'm not going to read the text out off the screen. This is in addition, if you like, or an alternative to the NHS 111 phone service, which has now been around for 15 years or so. So if you're using it within the app, it will carry over details saved. So a patient won't have to enter the check symptoms bit again, and they will get directed to the right care. Now, this one for me probably seldom gets mentioned, but I really, really want to highlight it because this is the functionality that the NHS website, NHS UK, provides in terms of the Health A to Z Finder and the NHS Service Finder, which I know that you'll all be familiar of because you will update your details for your primary care practices via the kind of back office system. So, you know, rather than using the website, if you're out on the go, if you've got your app on you or your tablet, then this really does beat Dr. Google at the end of the day. Just log onto the app and look at the Health A to Z website. Another one to call out here is the organ donation decision. Organ donation preferences can, of course, be managed by the app, whether that is selecting for the first time or changing the decision. Being part of research as well, you can see that there's a statistic on the page. As of October 2024, there were over 400,000 volunteers registered so far. It's a really great feature, this one. Gives you the ability to register to participate in health research. All the patient will need to do, or the user, is enter some basic demographic details and choose the areas of research which you, they, or are interested in being part of. So again, some top tips on this slide about functionality. I'm not going to read them out to you. I'm going to be passing back to Emma to talk about some NHS App future developments, as well as touching on the digital inclusion agenda. Thank you, Emma.
Emma, you're on mute.
You're on mute.
I knew I was going to do that at some point, so there it is. So I'm going to talk you through future developments. Thank you to everyone who is still with us. We have gone past the hour mark, but we are towards the end of the presentations now. We have got an NHS App roadmap. We have got a huge team in the NHS App. They're all working on different things on how they're improving the NHS App, as you have seen when we've talked through the slides. If you want to view the roadmap anytime, you can see what's been recently delivered, what we're currently working on, and what we plan to work on next. We've also got quarterly NHS App national webinars. Our next one is Tuesday, the 8th of April, 11:30 to 12:30. They're always Tuesday. They're always at that time. And we have got that's live now so that you can register for it. As I mentioned, we have got the Wayfinder team talking about the hospital appointments, and we've also got the work that we've been doing, the NHS App and libraries. So if you want to attend that, we also have got all of our future our past recordings are on NHS Futures. So if you do want to find out more about notifications and messaging, proxy access, test results, there are all previous things that we have talked about, so we can put a link in the chat to the that will link you to where they are. So wanted to touch on digital inclusion, because this is something that underpins it all, and something that always comes up about what are we actually doing about different people in different spaces. We know that digital can introduce a lot of barriers, and people can be excluded for a number of factors. It could be their digital skills and confidence, it could be not having access to a suitable device, or not having reliable and affordable internet. And so we have got undertaken a review to understand where in health inequalities lie with digital inclusion, and we have been working on a number of things. So we have got a partnership going with the public libraries, and that's being able to support people to access their health information and the app via the NHS account, which I mentioned before, using the library's Wi-Fi and their computers. And we're starting to have conversations with other organisations as well, because that has gone really well to look at similar partnerships. We're also widening the data information that we do have, so we'll be able to link it to other data sets. We are working to improve our co-design and working in more deprived and vulnerable communities, as well as continuing on our user research, which I will touch on in this slide. So we have got a fantastic user research team, and they have worked in running so many different sessions in so many different formats, just to ensure that the app is intuitive and usable, and they're testing their assumptions, and there is continuous improvement, so that can help focus on what we need to work on in the future. So if you're wanting to be part of the user researcher, or you have got patients or practice groups who are interested, if you're NHS staff, you can email Simon, or for non-NHS staff, there is a link there and you can find out about the user research. It really is important that we do continuously get the patient's feedback on the app. So we're going to go on to another poll, and I've refreshed this because apparently a lot of people were having issues with it. So hopefully we'll be able to get this up and it will be fine. But if not, please do put in the chat as well. So if Grace if you can share your screen. Thank you. So I wanted to find out if you had attended a national NHS App Update webinar before. Yes, no, I wasn't aware there were national webinars. So that is really, has shocked me actually, because we have over 1,000 people coming and attending the webinar. So people are finding out about it, but it's really great that you've let us know that you haven't, because now you all do know about the webinar and when the next one is. Don't worry, there's not another quiz that we'll ask you again. I think we got another question. Have you accessed the NHS App Tableau dashboard? Because that is what we're going to be talking about next. So 13 have, 20 have not, and 19 are saying, what is the NHS App Tableau dashboard? So that is a fantastic segue into James talking about the NHS App Tableau dashboard.
Thank you very much, Emma. And I've just loaded the NHS App Tableau dashboard on my screen. This is really interesting, not wanting to play regions off against each other, but the picture looked very different when we did our kind of dummy run webinar with the Midlands region this time last week. But that's great. I mean, I'm not a dashboard expert, but I'm going to give you a very quick whistle top tour, and I'm going to present my screen, and hopefully this will work absolutely perfectly. Perhaps Emma or Grace could just give me a shout, because everyone's disappeared.
I can see it perfectly. Thank you, James.
Wonderful. Okay, so this is kind of like your front page when you first log in. Now, how do you log in? You require an Okta account, of which I'm going to be perfectly honest with you and say I can't remember what the acronym is for, but somebody will post a link into the chat and publish it. If you have an NHS mail address, that's NHS Net, then you will be able to log on and create an account that will give you access to the Tableau dashboard. This is a really high level summary that we often use when we're presenting to regional teams. I actually haven't individualized it to London, but I can easily do that by going to the regions and selecting London, press apply, and then it will write a report for London. I think this figure is very much what Shanka was talking about earlier. 61% of GP patients aged over 13 years who are registered with the NHS app in London. If you can see my pointer, I'm going over to the kind of top right. You can start to drill down by ICB, PCN, and actually right down to GP practice level. So our team, who Emma, I, Patrick and Grace work for, policy and engagement, we urge you to sign up and start making use of this tool, because it's a really, really great way of tracking NHS app usage, uptake, adoption, etc. I'm now about to move on to a different report, hopefully. And again, could someone give me a shout if that's worked?
It has. We can see your NHS app usage.
This is great. So this is aggregated logins month by month. We're actually making some changes to the NHS app dashboard really as we speak at the moment. What you need to be seeing is unique logins as opposed to just how many times a patient logs into the app. That's work in progress, and we're hopeful to have that published by the end of April. For those of you who use the dashboard already, you will notice for the last 2 or 3 months, the GP Records Access tab has disappeared. We found an error in the data which ran from February to July last year. So we made the executive decision to remove the tab rather than having incorrect data reported. That report has been rerun, and we are just about ready to publish it again. It's gone through a quality assurance process internally. They have found some bugs in it, so they need to be fixed before we can publish. The minute it happens, we will communicate that out via the London region, which will filter down to the ICBs and practices. And I'm conscious of time, so very, very quickly, and I hope it shares again, I'm taking you to a screen which we call jump offs. What is a jump off? That's when a patient is in the NHS app, but they jump into a third-party provider. So you'll be familiar in some of the primary care online consultation tools, such as eConsult and Patches, Engage Health. Others are available. And for secondary care functionality now, Emma talked about the Wayfinder program, which sees patient engagement portals, PEPs, Where a hospital has commissioned a PEP, that will surface in the app, and again you can see that functionality as well. I'm just going to very quickly make this London region centric. Okay, that hasn't worked. Apply. It's because I never pressed apply. So there we go. I can see on here already, doctor, patients know best, Zesty. These are patient engagement portal suppliers. They're surfaced in the app. I certainly know with PKB, there's been a long-standing project in northwest London with PKB, which is why I'm sure there's really, really high usage. Lots of work to do in London, though, still, especially in southeast London ICB, where the likes of Kings and Guy's are using a supplier which is at the moment not integrated. So our Wayfinder team are working very, very closely with that supplier to hopefully onboard them as soon as possible. Like I say, whistle top store of the dashboard, and hopefully you'll have the links. And really, for me and the team, we'd love to see the dashboard usage shoot up. And I think as well, my final kind of point to you about the dashboard, we talked at a very high level, strategic NHS England level, about the priorities and operational planning guidance for the next financial year. One of the NHS app capabilities is just around core functionality. Use this tool to track your core functionality throughout the next financial year. Thank you very much. So this is still me, and I'm going to be talking about some of the common issues that we see with both the NHS app and NHS login. I'm just going to close the dashboard down because otherwise it's going to get in the way of my next presentation slides. Just bear with me a moment, please, as I move on to the relevant page. So we have an NHS app and an NHS login service desks, and they're there to sort out complex technical problems. We realise that some of the technical issues could be resolved at a practice level, but perhaps there isn't enough information in the system at the present time, or at least there hasn't been historically. So we wanted to share some of the common problems and the guidance that's available with you. Also, as well, our help desks are working on publishing frequently asked questions, knowledge bases. So more and more guidance will come out in the next financial year. And I'm already aware, for those of you who are NHS app ambassadors, you've had one or two technical, presentations by our service desk teams. So conscious of time here, so I'm going to rattle through it. This one will give you the 2 links when you need to raise issues with NHS England, i.e. us. So I'm going to not dwell on that one. There is help within the NHS app already. And that shows you how you, your patients, your service users, etc., can raise help via the app. It's really, really simple. Some of the developments that took place last year in improving the app's look and feel promoted this help screen. So, if you didn't see it before, you will do now. And then we're already moved on to it. This is what I was just beginning to touch on. You'll get the deck from us after the meeting. These are all valid hyperlinks. There's some really, really good stuff here. Sorry, can you just bear with me a moment? Somebody's contacting me on another channel that we have internally. Just switch that off. Thank you. Yeah, just please go through these. I know it's time consuming, but the service desk team have put together some really good assets recently on some of the common problems. So take some time, please, to have a look at that over the next month to 6 weeks, if you possibly can. I'm going to pass back to Emma now, who's going to talk about promoting the NHS app, something that we know you're all busy on, but Emma has some hints and tips for you. Thanks, Emma.
Thank you very much. These are the last slides, and then we'll just wrap up with answering any questions that we haven't. Just talking about promoting the NHS App, but when Shankar was talking earlier on about the stuff that you are doing about promoting, I'm not sure if I need to actually go into this too much because I'm already preaching to the converted. But if you're not aware, we have got NHS App walkthrough videos. We have got these are really short, concise to the point, and I've got such great feedback. There's 13 videos at present, and it just shows you how to navigate the app and how to use its services. It is on a public-facing page, so it's really useful that you can actually just share it with patients. If, oh, I don't know how to do this, share them that, and it's just something that they can watch really quickly. And then we have got our toolkit, which is got a wealth of information, promotional materials, posters, step-by-step leaflets, and we heard from some practices that they do have drop-in sessions, and then they invite people to find out the app and they use some of this information, which I'm sure a lot of you have been doing. There are also presentation packs, a bit slimmer than this, which you can download, and you can actually have meetings using the slides that we've got. So you could have it in with meetings with your team or with your PPG group. So all that information is there so that you can actually promote the NHS App. So some top tips: reviewing the toolkit and available resources, get yourself familiar with the Tableau dashboard, work with your PPG group if you've got them, championing the app, and then sign up to our future NHS page so you can find out about NHS national webinars. So before we go on to the Q&A section, we've got our last poll. So thank you for sticking with us, and we've already got that poll online now. So this question was, did you know that frequently asked questions, error codes and common problems are available in troubleshooting section of NHS App website? So quite a lot of you did actually, so that's really fantastic, but the majority of you didn't, so you're aware now. So as James taught you through that, so if there are any common problems, you can just direct your patients to that as well. And I think we've got another question. Were you aware about the promotional materials available? So the videos, posters and pamphlets. The majority were, but quite a lot of you weren't. So even though that you have got a lot of promotion going on in London at the moment, so there's some of you that weren't aware that it's there. So hopefully you can take some time to go have a look at that and see some of the amazing tools that you can use to support patients with the NHS App. And I think we have got one last question. So it's a call to action. We want to know what one thing you'll take away from today's session to be able to use for, to support colleagues or patients. It may be you're the only one that in the practice that is attending that you're going to be taking the information back. So this is really fantastic. We do have a feedback form which we will be dropping the link in the chat. If you could take the time to complete that as well, and I think that will be shared out. But that is it for the actual presentation. So thank you very much for sticking with us. So now I'm going to stop sharing my slides. I'm going to pop people on, and we're going to ask some questions that may not have been picked up already in the chat. So I was going to pop Patrick on, but he's not there. There you go, Patrick, you're back. I was looking for you and you wasn't there. So and if anyone else, if you want to pop up, and Simon, for you, Grace, if you want to come on, or Marion as well, to answer any questions, please do. But yeah, if there's any, I haven't been looking at the chat because I've been managing the slides. So if there's any questions that anyone wants to ask.
I think there's one theme which I'm not saying we're going to necessarily answer it in this question, but there's definitely still an ongoing theme about proxy access, which I think we all recognise in the system. And as James and Patrick and all of you have said, there's a pilot going on, and still some of that nuances. There's still, I think, the troubleshooting guide that James is signposted everyone to. I do think it'll pick up some of the questions around, linkage keys, where to find things. But there's definitely some comments about, would it be helpful if we get some screenshots of the actual clinical system showing where to find some things? But I think I'm not suggesting we need to answer them further, but maybe we need to get everyone to look at those links And potentially maybe there'll be a future webinar where we build on some of this themes around proxy and some of the linkage keys and troubleshooting, particularly if things move forward. So there's that set of questions. I don't know if anyone wants to come in with other sort of questions.
Yeah, sorry, Emma, can I?
That was just to respond to that. But yeah, so when we were pulling this together, like if we tried to make it back to basics, and you've seen how long that still is. So we wanted to make sure that people who weren't too sure of the app, that we can find that information, but we do know that there is space for other, to delve deeper into it and go into the technical side of things. So if that is something that we're hearing, that is something that we can definitely develop. We have, but with regards to proxy access, if you do want to find out more in the meantime, they did present at a national webinar, so you can find out a little bit more about that, the proxy program, if you go to our Future NHS site.
I'm also just going to, jump in as well, Patrick, before we move on to you. I have a presentation from the proxy team, which was for regional teams. It's about 6 weeks old. I'm going to pass that on to the London region, and I don't see any reason why it can't go out with the slide pack from today. It will give you some further information on proxy and some of the work that's going on at the moment that we've been touching on, and will run throughout the next financial year. Thank you.
Last word on proxy. I posted it in the chat, but you've got to realise that the NHS app, you've got other systems that's been around longer, like patient access or TPP, and so for care homes, for example, we use EMIS as proxy because you can, if you're at different practices. So if that's the situation, you can encourage patients to use, another app for proxy access because that's important to them. We don't say strictly the NHS app proxy access at different practices won't be available for another year. So in the meantime, they can use that. And I think, Shankar, you might correct me, I think that's also available for TPP on user
to a degree, but some of the themes about different practices and so forth still can be issues even in the different ecosystems. So so I think there's still definitely, it's not an issue that's completely cracked, or even if you're outside the NHS app.
And EMIS now is a great place to find information as well. There was this one question I wanted to highlight, which is it's a good comment actually around the plethora of partners. So there's lots and lots of things. You've got PKB, you've got patient access, you've got patches, etc. And the question is, why do we have all these? Because it confuses patient. And I know that's the case. Shankar is smiling. I think patients are sort of used to these, like AccuRx, etc., because it's so common. And you have got other suppliers, and we can't be all thing to all people. So we have to use other suppliers who's got the systems. So we integrate them into the NHS app. We do realize it can cause confusions, but we have to sort of help patients to realize that, these are genuine NHS partners that we are working with. And any way we can do that, whether it's on the website or word of mouth, will help that confusion.
No, I mean, the reason I'm smiling was, the way that I look at it, or the way I think about it for a patient is, the NHS app is the front door. It doesn't mean that we don't have side doors or back doors on our homes, but we still like the front door the most, surely. So when we're talking about patients, promote, I say we promote the NHS app first, and then maybe, yes, the side door you need occasionally, through some other product. But, you're trying to keep it still a common experience for the majority of the patients through that one thing. And then it might be, that side door is needed for some random use that's a bit more unusual or something like that. So I think that's one theme. I just want to pick up one other theme, and I'm saying it as a theme again in the questions. There's definitely the theme about the appointment booking, people saying about, that, practices are on triage models, you don't want to necessarily have them to directly book it. We've also got to be mindful about GP contract, where it started to say about online consultation, open thing. I put it in the chat, but I just want to make sure we're aware, and James, when you can jump in now, the teams are aware there's definitely discussions, exploration of it. And I imagine you'll be interested to see how this evolves in the future. So does anyone want to come in?
No, Shanky, we don't have our colleague Natasha Parry on today's call. She's actually doing some work with the NHS App team on this. It's been as well, I'm not going to beat around the bush, rather protracted. It's been going on for a period of time. My practice is in southwest London, and I've just had an in-app message, so that's really good. That worked perfectly, actually saying that they're moving to total triage with AccuRx, and this was a practice actually that had bookable appointments. So I'm really interested to see how this is going to work. Are they now going to switch the app booking off? So I've booked to go up there in a couple of weeks to chat to them about it, but there's a lot of work going on behind the scenes about how we can refine this process. Is it that actually we point, if you like, the appointments to the triage system, the OLC, or is it that we have, you know, like appointments bookable but for certain features anyway? So a vaccination clinic, I think there's work that will play out in the first part of the next financial years. And as Emma was talking about our excellent update webinars that we do quarterly, perhaps we can think about getting someone from the appointments team to come and talk to us, maybe for the summer one, if that would help.
Yeah. And I did put in the chat, James, but if your practice is one of those who don't do appointments, if you're doing total triage, then what we have within the NHS app at the moment is when it says you cannot book an appointment online, it does then says, what can you do next? And it points you to the online consultation. So it says, ask your GP for medical advice or ask your GP surgery a question. We did have a bug on it for about 6 months where if you were certain types or certain practices, you weren't getting it. I know that this was only enabled after the refresh in mine about 2-3 months ago, but that should be available for all patients who are using the NHS app. So although they can't book a direct bookable appointment, it will allow them to then go and book an online consultation if it's enabled in your practice, obviously.
Okay, any other questions?
Have you picked any others out?
James, there was a question around dental, and I did sort of said whether is dental information going to be available? Will dental information be available on the NHS app? And I don't know whether, I know that that's your background, so I'm picking.
Yeah, I mean, I haven't seen that. Sorry, what was it regarding?
It just says, when will dental appointment be available?
Yeah, oh, right, okay, yeah. I mean, you know, having been a dental commissioner in London for many years before starting this role 4.5 years ago, the dental system is completely different from the GP IT systems for primary care general practice. They're bought and paid for by the dental practice. They're not on the NHS spine at the present time. Dental practices don't use ODS codes in the same way, and we're somewhere off. What I can say about dental at the moment, going to the operational planning guidance that's just been published, the commissioning teams, of which you obviously have 5 in London, each in the ICBs, they're actually looking to buy in and purchase quite a lot of additional emergency dental care appointments. But actually in London, as you have a really good dental nurse triage service, which is available via NHS 111, which Shanka will know about, I'm sure. I think that actually emergency dental and the booking of it is there. But let's not count out using the app for dental in the future. You know, like we're pulling pharmacy in, and pharmacies really stood up during COVID. So for me, I think dental practices can be promoting the app at the present time. There are uses for the NHS app with dental. I'm happy to speak to anyone outside of the meeting about it. Thanks, Patrick.
No problem. One more question that I was not able to answer, which is a really good question. Is there a way that the NHS app can update prescription requests that have been rejected and then reauthorized by the GP? No, I've got to investigate that one to see, because I know that normally if it's rejected, issued, etc., it normally indicates on the NHS app. But if it's then rejected and then reauthorized, I'm not sure what the situation is. So we will take that one away and have a look at it. And one other question that I liked is about senior managers. So we do have a lot of contact with ICBs and senior teams, and myself, James and Emma. We're constantly regularly presenting to ICB boards to talk about the NHS app. We do use some of these slides, but we also obviously look at a strategic level, etc. So just, you know, just to say that yes, it's not only yourselves who are getting this, but the senior teams are also getting information about the NHS app, so they're aware of it. And we do ask them as well. Show hands. I personally show hands who have got the NHS app. And if there isn't 100%, then we will point them out. So yes.
Yeah, brilliant. Okay, so we are at time now. So
Okay.
and we've still got 128 people on. That is fantastic.
So can I just say a few thanks on behalf of everyone? So first of all, yes, I can. Okay, so first of all, I just want to say thank you to someone who's not here, Tara in our team, who helped arrange, coordinate this. As like I said, I'm just stepping in to help because she's not here. So big thank out to her who's not here. A big thank out to all you guys who are attending. You know, taking 90 minutes out of your day. Honestly, a round of applause. Please just react to yourselves. So hit that button. You know, we honestly really do appreciate this thing. I also want to point out some of your ICB teams. You know, like you have clinical leads in your ICBs. Behind the scenes, they're often spending a lot of hours on this work, freshening out issues, freshening up problems, working with the NHS App team. So a really big thank you to all your ICB leads who are working behind the scenes, which we don't often appreciate. And then finally, a big thank you to obviously the NHS App team. You know, I hope you would agree. You know, they present things such in a simple, really easy to digest manner, and they understand the depth of some of the complexity of the questions we're answering. And again, I'll say behind the scenes, you know, they're very smiley and happy here. They really do campaign for sorting things out behind the scene for all of us. And I really want to thank you for all the work that we don't often always see behind the scenes, and not just in this webinar. And it's been a really, really big joy. They've come out to help us out here in London. So thank you so much. Okay, right. Okay, so yeah, so thanks for everyone, and so we're going to wrap up now. But like as everyone said, you know, the slides we'll share. We'll try to do what we can do with the recording, and I really hope you have a really good, pleasant afternoon. Thank you.
Thanks, guys.
Thank you all. Bye bye.
Thanks, everyone. Thank you.